Hi, this is MC of Healthy by George. Think about subscribing. I'm here every Thursday and Sunday, and today I want to talk about Breast Cancer Awareness Month because that's what October is. And let me tell you, it's gotten chilly, so let's get into it.
Welcome to Healthy by George. I want you to know that this is for informational purposes only, and it should not be considered as medical advice, nor does it have anything related to my employer. So it's always best for you to check with your own medical provider before you do anything that I recommend or for any medical treatments. So please join me, hit that subscribe button, and turn on notifications so you never miss an episode.
So why is it that we need to increase our awareness about breast cancer? The issue is that 1 in 8 women will be diagnosed with breast cancer. And the goal is to really increase our awareness, especially when we're younger, because that's when our breasts are the densest. I remember when I turned, 60, I think I got the notice from my mammogram, your breasts are no longer dense. And that was pretty funny. But, because there always has been this very strange history in my family, and that's one of the key risk factors. Do you have genetic history or breast cancer history in your family? And so that's really the biggest component. If you have someone in your family who has a history of breast cancer, you definitely need to probably get more screening and perhaps even get screening that is not just your regular mammogram, but get an ultrasound, get an MRI of your breast, because that's really going to help if you have dense breast. You're someone who's younger. I think the problem always lies in what will insurance cover. I think that this issue of dense breast and these mammograms, even though that's the gold standard, if you have dense breasts, that's not going to be a very easy way for them to detect it. I know for me, the things that I did have some growths found in my breast. That was a strange experience, frankly. I thought I had dropped chocolate till my shirt. And it wasn't chocolate. And I didn't know I was having some blood coming out of the nipple. So that's another thing. If you have any kind of something coming out of the nipple that you need to follow up on. And that's what showed up. I had some benign growths in both of my breasts. And of course, it was very difficult to tell if it was cancer or not. And so I had those removed. I was so grateful to find out that these growths were benign. And I think for a large part of younger women who don't have a genetic or family history, they are probably some kind of a cyst or benign growth. But you really need to see it through when you have an early detection of some kind of lump or bump in your breasts or self-exam. And you should make it a practice of maybe every time you take a shower, give yourself a self-exam. And it's not just your breast, but it's the whole under your arm and the lymph nodes. And because I remember reading an article about one young woman who found a lump underneath her arm, and that was something that was hard to detect. The truth is we have to really encourage ourselves to not put it off, to get that yearly mammogram over the age of 40. I think that if you do have a family history, you should push the envelope and get some kind of genetic factoring to see if you have a BRCA1 or a BRCA2 mutation. And make a decision then if you want to do something like I think Angelina Jolie did, which was to remove her breasts and take away the risks, which is a hard decision, frankly. But if it's about getting cancer gone and not having the risk, then perhaps it's something that you can really embrace, especially with the types of breast reconstruction that's available now. And I think as we get older, while we may get less dense breasts, we do increase our risk because most of the cases of breast cancer are for women like me over the age of 60. I was really glad when I got my MRI of my breast, which was free because I was part of a research study. I don't know if my insurance would ever pay for an MRI. And so really that gave me a sense of I don't have anything at this stage of my life that could potentially indicate that I have cancer. But the truth is I have to stay on it. I'm going to have a mammogram every year, is despite how uncomfortable they are, despite how much we don't like to get them done. And right now, that is what is pretty much covered in our insurance. But if you do the self-examinations and you do your yearly mammogram, you can really help yourself when it's trying to prevent or to reduce or try and get an early diagnosis if you do have breast cancer, because the treatments for cancer in the breast are really much better. People are surviving longer. People are having to have less invasive surgeries. If it is just a lump, or they can do a lumpectomy and preserve some of the breast. So it's really a very positive thing to make sure that you're getting your daily, or when you take a shower, breast exam, because that's the best time to do it. And if you don't really understand how to do it, guess what? Here we are on YouTube. You can do a video and search and find many ways of people demonstrating how to do a self-breast exam. I know that was something that I felt a little clueless about. I've talked to my primary care doctor, I talked to my OBGYN, and I felt very much reassured that I was understanding what I needed to do for breast self-examination. The other things that you can do, too, are just living a healthy lifestyle. Reduce the sugar and move more. Those are the two biggest things that we can do for our health. So think about, when was the last time you had a mammogram? When was the last time that you remembered to do a self-breast exam? We really cannot emphasize enough how that needs to become part of our daily routine, the self-exam, and then the yearly routine of getting a mammogram. You never, ever know, especially if you're someone who has dense breasts when you're younger. You really do need to be on top of that. And I've known of many a case where if someone didn't have any risks in their family, history or genetic, and they found a lump. So let's face it, we have to be the advocates for our health, moving towards making sure that we are testing ourselves yearly, we're doing that self-exam, and that we are doing what we can if we notice anything unusual coming out of the nipples of our breasts, or even sometimes the shape. If you notice anything unusual, believe me, that's when you go and insist on having your either primary care doctor see you or your OBGYN. So let's all celebrate our breasts this month in the breast cancer awareness. And let's really support each other in doing what we need to do to live a healthy lifestyle, move more, eat more whole foods, drink less alcohol. If you are someone who smokes, think about stopping or reducing smoking. And then if you're someone who has been on hormone replacement therapy, while I'm pro-hormone replacement therapy, there are many controversies around that. Get educated. Talk to your primary care doctor. Talk to your OBGYN. Learn more about what hormone replacement therapy is. Be well, my friends. We have this one precious life. And so let's take care of ourselves this month as we are becoming more aware of how breast cancer can be defeated by us being proactive. Check me out every Thursday and Sunday here on YouTube. Bye-bye.
So thank you so much for joining me at Healthy by George. I hope you found the information inspiring and that it encourages you on your wellness journey. Because remember, your body, your well-being are a most precious gift, and every tiny action taken daily can make a huge difference. I hope the information here is educational purposes and is not meant to replace your medical care. See your doctor and talk about what works for you. If you enjoyed today's content, don't forget to give it a thumbs up and subscribe to my channel. Your support means the world to me, and it helps me continuing creating content that inspires and empowers you to live your best life. Goodbye for now, and join me again at the next Healthy by George.